all across this country, people are saying we do not have enough doctors, we do not have enough paramedics, we do not have good health care. Dr. Shawn Whatley is a doctor, and he was the president of the Ontario Medical Association. He's an author. He joins me right now because I'm hearing from some people that it's the colleges, the disciplinary bodies, who are controlling the number of doctors. And if they were not just so stuffy, we would have more doctors in. In fact, not only more doctors graduating, but more doctors immigrating into Canada and being labeled doctors, able to practice.
So everybody has an opinion on how many doctors we need, and everybody makes that opinion known.
But everybody agrees there aren't enough, right?
Well, actually, I push back on that slightly. I think we do not have an absolute lack of doctors. We have a relative lack of doctors due to an absolute lack of freedom for most doctors. Some rare specialists, pediatric neurologists, yes, we need more of them. But family doctors, for example, not too long ago, they could care for 2,500 patients. Now we struggle to take care of 1,200 or 1,500. Well, because of the paperwork and bureaucracy. I have to spend an hour with paperwork to spend an hour with patients.
So that's a government thing, or the government bureaucrats, or the hospital bureaucrats. So does that mean then that the practice needs to be redefined, and you, instead of doing paperwork, could be operating or doctoring and have somebody else do the paperwork?
I love to blame bureaucrats and the government, but it's actually often doctors' faults. I come up with a beautiful plan, a checklist that must be done for every depressed patient. Well, I've created that checklist. At some point, we have to ask, how much more value does a beautiful chart add to me? Or am I just doing a beautiful chart to protect me from people like you, the lawyers?
Well, I was just going to say, we should blame the lawyers. But I mean, look at the hospitals. Many doctors tell me that, 24 years ago, there was 3 or 4 administrators. Now there's 300 of them. They have their own buildings outside hospitals. Is it like the government? There's just so many bureaucrats grinding things down that we can't move.
Well, yes and no. If you didn't have the bureaucrats, you wouldn't get the funding from the government. So you need to have this gigantic team and a whole department of people there just to get the grants and loans and extra funding.
That's rotten.
I agree.
It's true, but it's rotten. Sorry, go ahead.
I agree.
And so, but is there a better way? If we had some premier that came in and slash and burn, just say, you know what, we're getting rid of all these bureaucrats. We're just going to give it to the doctors and the paramedics. I talked to a doctor the other day. He said, in the States, I had 8 paramedics working for me. That's 9 people taking care of people. We can't do that in Canada.
So we're mixing 2 things together there. Yep. The bureaucrats, absolutely, we can get rid of them by focusing on activity-based funding. Hospitals should have to compete for the dollars they get as opposed to simply getting a gigantic budget. That's separate from leveraging the professionals that we have. So no lawyer, dentist, or accountant does everything themselves. They hire other people for helpers, and we need that in medicine as well.
The New Vista of Medicine by Shawn Whatley. Thank you. Thank you for contributing. We are almost out of the hole. People like the show, and we want to keep it on the air. So press subscribe. Press PayPal. PayPal is really simply a credit card that you can pay with. And if you're writing a check or a letter, please put your address in, because I will send a letter to everybody who contributes money. Subscribe, PayPal. Thank you.